Hello, my name is Latara Jennings. I'm here today to show that Ashford Hospital has violated my rights as a patient and employee. They have done so by disclosing private information about my personal health. This information was supposed to be safeguarded. As an employee here at Ashford Hospital, I understand that only certain medical providers, whether they are physicians, nurses, or therapists, may have access to my medical records as long as I'm under their care. As a patient, I was seen by the OR, the operating room department, to meet with the physician to schedule an appointment of my upcoming surgical procedure. A schedule of my procedure was emailed to the OR staff as well as to my supervisor, who is not part of the OR department. With this email, my personal health information, or PHI, was included. Not only did my PHI disclose my name, it also shared my demographic information, my social security number, past medical history, my primary care doctors, my psychiatrist's name, and other health professionals that I have seen throughout the year. The Privacy Act of 1974 states that no agency shall disclose any record which is contained in the system of records by any means of communication to any person or another agency except pursuant to a written request by or with the prior written consent of the individual to whom the record pertains. Although my supervisor is part of the hospital senior administrative team, he still does not have access to my personal health information because I'm not directly under his care. The Health Insurance Portability and Accountable Act of 1996, better known as HIPAA, was designed to issue privacy regulations that govern individuals' identifiable health information. Under the HIPAA Privacy Act, the permitted uses and disclosures states that a covered entity may disclose protected health information to the individual who is the subject of the information. I feel as though my supervisor is not part of the OR team and the information shouldn't have been sent to him. The Office for Civil Rights, OCR, explains in the limited uses and disclosure to the minimum necessary portion of the HIPAA privacy rule as for internal use, a covered entity must develop and implement policies and procedures that restrict access and uses of protected health information based on the specific roles of the members of their workforce. These policies and procedures must identify the person or class of person in the workforce who need access to protect health information to carry out their duties. The categories of protected health information to which access is needed, and any condition under which they need the information to do their jobs. As my right under the HIPAA guidelines, I understand that healthcare providers is prohibited from disclosing PHI to employers without patients' written authorization. And it is clearly stated that my supervisor was informed of my PHI, which was violated. I also understand that HIPAA allows healthcare providers to disclose personal health information to certain third parties for care-related purposes, but aren't enforced to. The OCR explains that the data safeguards were also designed under the Privacy Act to ensure reasonable and appropriate administrative, technical, and physical safeguards to prevent intentional and unintentional use of disclosure of protected health information. Safeguards should include limited access to keys and passcodes. The Privacy Act was designed to protect a person's personal health information from those who do not need to know. As a patient and employee that have trusted, allow my personal information to be disclosed with my supervisor. Not taking the appropriate measure to protect my personal health information, Ashford Hospital shown me unprofessionalism. And with this knowledge, we do not know if this has happened to other people or what other ethical values Ashford Hospital has broken.